Regarding the COVID-19 situation, we have in the last 24 hours tested 2,567 samples, out of which some 52 people have tested positive for COVID-19. This now brings the total to 1,161 persons who now tested positive. The cumulative tests so far are at a high of 55,074. In terms of the spread, Nairobi has a higher number this time with 23, Mombasa with 7, Busia with 7, and I would like to urge the government of Busia County to become extra vigilant and extra careful because it is a border point. There are a lot of truck drivers in Busia, and you can see that the figures in that county are beginning to grow. On our part, the Ministry of Health, we will take all measures possible and necessary to support Busia County so that the figures in Busia do not continue to grow. What we have done is that we have told the truck drivers to test 48 hours before you get to the border. Don't go to the border to be tested at the border. Because if you get there and you have to wait for your results, then you are just going to clog up the border. And you cannot enter in Uganda. You cannot enter into Uganda unless you have got a COVID-19 negative certificate. So we are urging our drivers to take the initiative and test earlier. If you are heading for Namanga, if you are heading for any border. Further, we have instructed that we are not just talking about testing drivers, cargo drivers who are moving and traveling outside the country. Anybody, any driver, any cargo driver leaving a designated area must be COVID tested. You cannot leave Mombasa unless, and you have got a cargo, unless you have been tested. Because other people are not traveling from Mombasa. It's closed up. So what we are saying is that for you to protect the others, because it is you who should hold the responsibility of protecting the others. So if you don't know that you are negative, then you should not leave Mombasa. If you don't know that you are negative, don't get into a truck and drive to a border post and then just stop your driver there, your truck there and wait.